Hey guys, it's Dr. Webster, and I want to talk about hygiene today. Hygiene tips. The most important thing we do when we see patients is make sure that the mouth is healthy and the gums and the teeth are healthy. And so I found that these are very successful. Both as a patient, I applied these when I had braces, and it's also things I always recommend to my patients. The first thing I'm going to recommend is make sure you see your dentist at least every 6 months. And with most of my patients, especially braces patients, they'll see them more regularly, like every 4 to 6 months. And you want that just so you can have a professional cleaning, make sure everything is good and you don't fall behind with that. Because even though we do these things, or some things that we're going to talk about daily, you still need to see a professional dentist regularly, at least every 2 to 3 times a year, to make sure the teeth are clean. The second thing I'm going to recommend is brushing after every meal. That may seem tedious or impractical, taking a toothbrush with you to school or to work or out when you're with your friends, but it really does have a significant benefit when you clean your teeth right after you expose them to food and all this other stuff. Third thing I'll recommend is don't snack throughout the day, and definitely don't sip like soda throughout the day. All you Diet Coke drinkers, I'm talking to you, that's constantly having that open can at their desk, sipping it throughout the day. That is really bad, just because you're constantly exposing your teeth and your mouth to sugar and to carbonation and stuff like that throughout the day. And then the fourth thing that I'll recommend is at night you need to do what I call the complete overhaul. And the complete overhaul is involving 3 things. The first thing is to floss. You need to floss and do it first to get all the gunk out of the braces, or taking off the aligners, making sure that there's no teeth that are going to get in the way of your your toothbrush, or the mouth rinse that we're going to talk about later. I know for braces patients that is really hard because the braces are in the way, but you need to just do it. When I had braces, it took me 15 minutes, and I was looking in the mirror trying to figure out how to thread it through. But as I did it every day, it became easier, and eventually I was able to not have to look in the mirror. It took me less than a minute for me to do it while I was watching TV at the end of the day, but you'll never get to that point unless you do it every day diligently. So that's the first thing at night. And again, you just do these things. The overhaul is at night before you go to bed. Flossing is the first. Second thing, use a Listerine rinse and do that for 2 minutes. This is going to prepare set up your toothbrushing for more success. It's going to loosen up all the plaque and just kill a lot of the germs, so that when you go in with the toothbrush, it's a lot more effective. You want to do this for at least 2 minutes. And what I found with patients, because it doesn't taste that good, sometimes it stings, especially if patients haven't been doing it, they have gingivitis, or they have some inflammation in their mouth. It's not the most pleasant feeling, but you got to keep it in there for 2 minutes, because if you spit it out after 10 seconds, it's not going to do anything. And as you do that regularly for 2 minutes, you're going to get, the taste isn't going to be as bad. You're definitely not going to feel any stinging, because the inflammation is going to go away. And then the third thing is brushing, preferably with an electronic toothbrush. Do that for 3 minutes. You want to angle it like at a 45-degree angle towards your gum line, which is the place where your gums and your teeth meet. You want to do that for 3 minutes. You just want to, especially if you have an electric toothbrush, you don't have to do any work. You don't even have to brush. You have to worry about brushing too hard and causing recession. You just let the toothbrush do all the work, and you just go around the horn, both on the cheek side and on the tongue side, on the upper and lower teeth, and then just go to bed, and you've got a clean set of teeth before you go to bed. Those patients, and me myself, I'll add my testimonial to it, that do that regularly, I never have a problem with hygiene with them. And they have a lot better chance of not getting cavities and not having dental problems after treatment, white spots on their teeth, stuff like that. That's it. Leave your comments and questions. Always feel free to call us if you have any questions, and I'll catch you later.